When you're doing an aromatherapy massage, you want it to be different than your Swedish massage. You shouldn't be doing the same technique. You can always add aroma to your Swedish, but if they want a particular massage that is an aromatherapy massage, it really should be different. It should be different. You're more interested in their absorbing the aromatherapy, the essential oils that you're using for their benefit, and to relax the body. So we're not going to use petrissage. We're not going to use our hand in grabbing the muscle, moving it back and forth. Most of our work, all of our work, is going to be effleurage, compression, and friction. No tapotement, very little vibration. Vibration will be rocking, translation, that type of movement. What makes this different than the other techniques as well is you're going to do whole body work. I'm going to go from the nose to the toes and back up. I'm going to do the entire surface of this half of the body, prone position, within my time frame. If it's a 50-minute massage, I'm going to do the 25 minutes complete. I'm not going to do arm, back, leg, leg. You're not going to chop the body up. For the person, it feels much more complete, and it feels like they got more of a massage than they would have if you stopped and broke the body up into parts. The trick with this is called a balm. It is a gel, a wax product. It's much, much better for massage. You don't have to use as much, and you get much better stretch to the tissues. There's not a lot of slipperiness to it. And it only takes a little bit. So whatever I've bought or used for my balm, I just have to know it's going to go 3 times as far as the other oils. So maybe I did have to spend extra money in the beginning, but in the long run, I saved money because I didn't have to use as much. You're going to put this on you first. I'm going to massage this in to what I'm going to be using for my massage. So my hands, my forearms, and my elbow get the oil or the balm put on first. I don't want to be taking it back off his body, so if my skin is dry, I'm going to absorb up the balm, and I don't want that to happen. Now, during the massage, if I feel that it's beginning to drag, just stop and apply more balm. The trick to getting an even coating with this type of product, with an oil, you fill your hand, you start here, and you spread it around. You can't do that with this. You'll end up having a lot up here and none down there, or you'll end up using way too much just to get a coating. So what we're going to do with this type of product is we're going to press it into the skin first and then go back and spread it. So my first strokes are just going to be compressions to apply the balm. So I'm going to do this everywhere I'm going to work. The back, the chest, the arms, the table isn't very low because I'm not going to be going deeply into his body. I'm simply trying to stretch his fascia. But just be sure that it's evenly applied everywhere it needs to go. On someone who has a lot of body hair, of course, it's going to take more than if they don't. But remember to always start your stroke going with the direction of the hair growth. So once I've compressed it, I'm going to come back and I'm going to start my strokes going down. You need to coat the hair. And then once you get it on there, you can come back and make sure it's all massaged in. To add more, if you think you need more, you just put a little bit in your hand and start. Now because I don't have my little warmer right here, this is going to firm back up. At room temperature, it's a solid. So I've got two of them. I have another one in the warmer, so I can swap them out. If you're working with a private client or somewhere that you're working, you're going to have a bottle warmer with you. So you're going to be able to use this really easily. There are other devices you can buy that will keep it warm for you. If you want to keep it in a little souffle cup, you just, this oil definitely has to be warm. If you look at the skin, it should be glistening, not shining. It's a dull glisten, and that's more than enough that you need. And it's all about rhythm. So once I'm sure that I have everything on here that I want to have on here, I can go down, skip over the underwear, and bring that stroke all the way down. I can come back up on this side of the body, then down the arm, off the hand, maybe back down the leg, maybe back up the leg, then across body. It's really up to you. You have the full use of their body from top to bottom, and you can make what we call runs, whichever direction you want them to be. So I can go from the leg to the hand, or I can come up the leg and go over the underwear. Or I could stay up here, work a lot on the back, and the neck, and then come down and work the legs. I can work them separately or together. If you're going to work them together, you want to be able to work all the way up to the heel, from the heel to the butt. So you're going to need a stool. So if I want to do a little deeper, is that okay for him?
Yep.
Lighten up at the back of the knee. I can do that from my stool. Then I could go back up the body from there, up to the shoulder, back down to the other side, and back down. Come back up together. It's all about rhythm too. So if I'm going to work that upper shoulder, I can do this. One, and then the other. One, and then the other. If I want to go deeper, forearm or elbow. Is that okay? You can test and keep your pressure where you want it to be by using a mother hand to support on the table. And I'm going to rock between one and the other. So maybe my first pass isn't as deep. Most of my weight is on this fist. As I go deeper, I take the weight off this hand and put it on this hand. So I can vary my depth just by moving the weight from one arm to the other, from one arm to the other. Now, what feels really good with this, how does it feel, Tony?
Wonderful.
It just is such a wonderful feel to the ball. Is you want to do a nice stretch top to bottom, and you want to have as much surface contact as you can. So you're not going to use a lot of hands. Most of your work is going to be forearm work. You want to try to use your forearm and your elbow as much as you can. Not like in a Swedish when you don't do that much, but here you do. And you can combine them. You can put them together where you give them a really, really nice stretch. So if I lock my fingers together, I can start here, bring that arm up, this arm up. Now I can do it just on the back. Or come down the arm. Or go all the way down the body. Try not to pull their underwear down. And then onto the foot. And I can do this on the foot. And then I can either come back with one forearm, go back and forth between the two as you go up, or just straight. Then I can come back like this and go back into the side-to-side movement. Then come over here and do this side. Or all the way down. Lift up. Come back down. And I can really go deep with my elbow. I mean, I can really get that calf muscle doing this. Come off the foot and around on the arch of the foot. And you can come back up with one forearm or connect them but make circles with your stroke and come back up here. Now he's doing really well with his skin, but other people, they may be a little drier. So the back still feels okay, but the leg is a little dry there. You're going to have to stop and put oil there. But remember, I keep saying oil, balm. Remember, you only need a little bit. You just need to recoat it because this is not going to sink in like an oil would. This is a good stroke, a good technique to do where you do what I showed you before with the back. Take the arm off, hold it with your superior hand, pick up the drape, hold it with that arm, and then sit down. Oops, slide off the table. That plastic is slippery. Or if I don't want to fight with the base sheet, I got a towel. Just remember, you can't put their arm down directly on your clothing. Number one, it'll get you the product all over your clothes, but it's a little bit too intimate. So whenever you're touching your body to their body, there needs to be drape between the two of you. But this works really good from here. So I can uncurl that upper trap just by leaning back, which is what we would consider a deep tissue technique. If I want to work the spine, I'm going to work it on the side that I'm sitting on. And most of the pressure is under my elbow. So my first few passes, I'm not going as deep, but now that he's warmed up, I can go all the way up onto my elbow. Let me know if that's too much. And the rule is, the deeper you go, the slower you go. But if I'm directly over my work, I'm not straining my shoulder. I'm not straining the shoulder. Come back and do the neck, and you can do the arm from here. But now, I'm not going to do this to the arm, right? Because I don't do that in this technique. It's fists. It's stroking with your fist. And you can really get those teres muscles and that lat along the edge of that scapula in this position with your fist. A nice stretch. Lean back and put, is your shoulder okay? Mm-hmm. Okay. Put their hand on the medial shoulder with their palm up. In the bowl of your palm, hold their joint capsule, their shoulder, and just lean back with that whole thing. Then when you come off the table, just slide it until you're back putting them on the table. Then I can come back up. Now that he's warm, I'm going to want to do a little deeper work. Now I can with my fist. I can come back and go to the bone because his tissues are warm and they're gliding and they have changed from thixotropy. They're much more gel, liquid-like now, and they can take it. Put your fists together. Remember, you want to get as much surface area at one time, and lift up those muscles with both fists. Then when you go down, you can go back and forth from proximal distal with the joints. And then on your side of the spine, move it with your knuckles. Remember, this is where all of the reflexes are for all the meridians and the lymphatic system, Dr. Chapman's points. You're right over the ganglions for the sympathetic nervous system, and you're able to relax them. Now up here, I'm not going to do this with my hands. I'm going to still keep it a stretchy movement. So I'm still going to do a stretchy movement, but I can go back and do pressure points. So rather than doing finger manipulation, after that I'm just going to come back and do gallbladder, 21. And then go back into this. Hands, just remember, not a lot of finger work, so I can do this in the hand. But there's really not much you can do in this position anyway, so when you bring your hand off their hand, remember, we don't stop our stroke here. The arm continues on, and you should continue right off the fingers, but put your fingers between their fingers. So as I'm stroking off, I go between his fingers. Now when I come back up, I can do a little stretch for him. and then come back up, okay? Feet, be creative. You're not going to do petrissage. You can do rolling knuckles. Or just stretching the foot out. If I wanted to do bent knee position, I could using these particular kinds of strokes. I'm just not going to do any finger work. So if I'm up like this, it's going to be compressions, pulling it away, pulling it away, pulling it away, stripping it down, and opening it up. But no work like this, okay? Just remember, no work like that. You can still do in this position you can work the thigh, and you'll notice it's much softer because you've broken the tension. Those muscles are two joint muscles and they need to be relaxed in order to work deeply into them. So if I really want to work his hamstrings, I'm not going to do it with the leg flat. Lift your ankles up for a minute. Okay, my dear, I want you to scoot down on the table so that your face is on the table. Bring your shoulder to me, turn all the way around to your back. Face cradle okay for your neck? Mm-hmm. Face cradle okay for your neck? Yep. So the same rules apply. Fix the head first. Watch them turn by their feet. Now, he's got a hairy chest. You're not going to want to try to work with all this hair, right? And you really don't need to. So just do compressive work on the chest. I don't want to try to coat all that hair. That would not feel good. So I'm not going to put anything there. It's up to you, but trust me, you'd walk out of it it would feel awful. It's like somebody put Crisco lard on my chest. Now these are excellent for the face, so I don't have to worry about using a body product on their face. These are pure essential oils and the wax, so it would work just fine. And you notice I'm not going very fast, right? I'm going very slow. Down the arm to coat the hair, not up the arm. Now here you do. You worked on the neck before, there should still be some there. But you are going to come back and work the neck, so you do want to put some balm up here. Now, most men want their chest worked on and their abdomen worked on, but you still need to ask. Ask them if that would be okay. And if it were a lady, you're going to have a breast drape on there. Now it's kind of difficult in supine to go nose to toes, right? So you're going to have to do it a little bit different, but you can still do full body work. So if I wanted to go nose to toes in supine, and I don't really have any oil on his chest. I'm just going to go hand to leg and back up, leg to hand. And how you mix it up is really how you want to do it. So you're not going to do this, okay? You can still manipulate the tissues, but it's going to be with the fists, this kind of movement, little figure 8. And you can vary this by, this I have equal pressure. Now just pressure on the bottom hand, just pressure on the top hand. So I can do that a couple of different ways, just by varying which hand I go deeper into his tissues with. If you're going to use your forearm, remember it's never with the hand towards the midline. So I'm not going to do this to work on the supine position with my arms. It's always going to be this way. Hand is always going to point away from the body. Use a really wide stance and just bring your weight all the way over. This is the pressure stroke. Archer, keep your back straight and just lean into those tissues. Lean into them. Come back up. Tensor fascia lata. I want to go a little deep, but I don't want him to struggle. If you just bounce it a little bit, it doesn't feel as invasive as if I just did it straight, top to bottom. Not much there, you already did the calf, right? So it's really just kind of some stripping on those peroneal muscles for this part. So where you're going to concentrate most in the supine position is the shoulders. So you got more time to do that, and then more on the feet. So when he was prone, I probably wouldn't have spent 5-6 minutes on the feet, just a minute or two. Because now there's not much leg to work on, I can spend more time on the feet. So how much time do you have on the lower body, prone or supine? How much time? You're doing a 50-minute massage. How much time do you have on the lower body? 10 minutes. How much time do you have on the upper body? 15. Total is 25. In this position, though, with the balm, I don't really have to be so precise in how I chop the body up as I would if I had to go one part to the next, because I can do an awful lot of full body strokes to get everything. Especially if they told me, I really like my feet being done, right? You want to give them at least 5 minutes per foot, because that's what they like. So you got more time to do it. So if I do a couple of full body strokes with the legs, I pretty much don't have to worry about anything else. This is all I need to work on here is the peroneals anyway. So I could give him all of that time on the feet and still make it a complete feeling work. So you could come up, leg to hand, under the shoulder, across the chest, arm to leg, or like in the bendy, it's up and then back down, up and then back down. Maybe around and around on the legs, maybe shoulders, come back and do something full body again. And then it's kind of up to you. Do I start on the head? Is that where I would start? If you're looking at it energetically, yeah, you would. But not necessarily. You don't really have to. So I may work the chest muscles, the arms, do my full body strokes, and then come back and do the head. Because remember, I'm not chopping him up like I normally would. I'm not going from one part to the other. I'm going to come back and do the whole body. So I don't necessarily have to do the head first. I could complete the arms, do some back strokes, full body strokes, and then come up here and spend a little time on his head and his neck. And it's all just leaning. And just a little bit Just a little bit of this is all you need on the face. Just a little. Most guys, they don't want any on their face anyway, so you don't need a lot. When you're done, if they do not want this on there, you can take it off with alcohol, but try to explain to them that the benefit is going to continue for hours after the application. So it would be better if you did not wash it off. But you're going to tell him a couple of safety things. When you're working with aromas, especially ones that have citrus in it, you're going to be very sensitive to the sun. So once you've had this treatment, please do not go sunbathing. Don't go to the beach. Don't go outside, play tennis or whatever. You need to stay away from the sun for a couple hours, at least maybe the rest of the evening. And the other feature about that sunbathing, and what else that you have to be careful of? You don't want this, you don't want to be drinking, right? What was the thing about drinking? Because essential oils do detox the body. That's one of their properties. So they should not drink 2 hours before the treatment or 2 hours after, at a minimum. It'd probably be better for them not to drink for 6 hours, but at least 2, and explain why. But remember, if you're in a resort somewhere, they're pushing drinks on the guests, and the guests are on vacation and they want to drink. So if they do, you informed them, they made the choice to get the service anyway, so you had informed consent. You can still do it. If they get sick, oh well. You tried to tell them and they got sick, so. This would be a good service to do the chakra balancing at the end. So we're going to hold, right? Left hand is always superior and moves first. Ankles, knees. Bring this hand back over to the hips. Base, root chakra, sacral. Solar plexus, sacral. Heart, I always forget to do the minor chakras, but you can do the minor chakras. The spleen, heart. Then you're going to reach back, ankles, wrists, elbows, shoulders, throat, and heart, brow, throat, crown, brow, off, brow. Okay? Compressions can be squeezy compressions or just compressions. I like to use a towel instead of a sheet, but you can use a sheet. It's all according to what you think you want to do. If that person told you that they had something to do later on that night, they're going to go out to dinner, they might go dancing. I kind of want to put some blood back into their limbs. So I'm going to go centrifugal and not centripetal. So I'm going to start up here and work my way down. If they're relaxing, they're going to be at the spa the rest of the day, they don't have anything planned, then you're going to bring it back up. You'd start on the legs and go back up towards the heart. Back up towards the heart. You can also do your warming frictions to take a little bit more of it off. And you have to tell them with any kind of oil, any kind of product that you're using, they have a charge now to their skin, especially if they're using essential oils, which will attract dust and dirt. So if they have this treatment done, even if they're sitting under an umbrella and they go out by the pool or they're out at the beach under an umbrella, all the sand and everything that gets anywhere close to them is going to come and stick to their skin. So it's not a good idea. Not a good idea. Try to stay somewhere clean. Don't go out in your garden. Don't go garden after you do this. You know, it's going to be kind of icky. Very icky feeling. But if they insist, they really don't like it, they need to take it off. If they don't go shower, you can always use alcohol. You have to use alcohol. If you just use a warm towel, you're not really going to take it off, right? So you're going to warm the alcohol in your hands and you're going to rub that on. Then you're going to use the hot towel, okay, with this particular product.